Good afternoon. Welcome. My name is Kimberly Blackfin-Khan. I'm the director here at the Ignite Hub. Welcome. If this is your first time, either in person or online, we welcome you. Tonight's presentation, this is our Fireside Chat Career Series, which is sponsored by Verizon, who, for those of you that are here in person, we had our wonderful community dinner. That's thanks to Verizon. Tonight's topic is journey from healthcare provider to tech founder. So I'm very excited to have Camila Mantle with us tonight, who's going to talk about her career journey. I'm going to switch here to my. Okay. Great. So welcome again. We have our guest tonight, Camila Mantle is the founder of Epic Technologies, a mobile app designed to increase the language, speech, and recognition in individuals with neurological, did I miss it? Oh, and cognition in individuals with neurological conditions. Camila has been driven by a lifelong passion to work with geriatric and elderly populations and is deeply committed to providing care, support, and evidence-based therapies to multicultural communities striving to bridge gaps in healthcare access and equity. Camila holds a master's degree in speech language pathology with a focused concentration on medical populations from Howard University and has over a decade of experience in medical settings specializing in stroke and neurorehabilitation. Camila has had the privilege of working with diverse communities across cities such as New York City and Washington, D.C., with a primary focus on adult neurogenic population, particularly those affected by stroke, aphasia, and dementia. Welcome, Camila. I'm going to turn it over to you. Thank you.
Hello. Hi, everyone. Good evening. Thanks for coming. I'm really excited to be here and talk with you all. I'm Camila Mantle, founder of Epic Technologies, and my presentation is called From Healthcare Provider to Tech Founder. Next slide. So today I'll be covering my journey to becoming a tech founder, role of speech pathology and oral rehab, challenges and key milestones along the way, and how professionals can drive innovation in tech. Next slide. All right, so my childhood and early influences. I love the DMV area, but I am a native New Yorker, okay? Very much so a tri-state girl. My parents are from Jamaica and Panama, and my culture is very important to me. My personality, a lot of these things that I'm going to mention kind of drove why I got into this field of speech pathology. But my personality growing up, I was very assertive. I was the only child for a while before my sisters came, so I had only child syndrome for a little bit, you know, a little spoiled, a little bratty, assertive, Sagittarius. And I talked a lot. My parents have this joke that I started talking at 10 months and I haven't shut up ever since. And it's funny that I'm in the field of speech pathology now. Old soul. I've been thinking about recently, like why I'm so attached to older people. And I think it was because growing up, I was very close with older elders in my family, older people in the community. You know, they spoiled me, they gave me food. I got, you know, only child thing going on. So I had a lot of attention given to me, and that was really great. And then jobs, volunteering. Anyone here volunteered as a child or in middle school or high school? Anyone? Okay, can you tell me where you volunteer? Yeah, yeah, yeah. Just really quickly. Just really quickly. Well,
So actually, I come from a family of medical professionals as well, and they are very focused on community service. So my first time volunteering, and some people in this room will know about this, we participated in the Hands Across America in the 80s. So that was, of course, you know, again, raising awareness about hunger in the community as well. But I did volunteer in the middle school. I went to the YMCA and did summer camp and cleanup projects, a variety of things. But I can go on and on, but community service has been a big part of my experience.
Anybody else volunteered as a child? Any? Key club. Anybody else? No? Yeah.
Volunteered as a teacher, and then also my parents, where they worked, my dad was a social worker in DC, so would help volunteer work come.
My mom was a social worker. And when I was 15, she told me, I think I was too young to officially work on the books, but I was too old to be sitting around and doing nothing at home. And she's like, what are you gonna do this summer? And I was like, I'm not sure if you're gonna volunteer at a nursing home. And as a 15-year-old, working in a place where people are, suffering and might, have a lot of health issues, you guys know what my experience was at the nursing home at 15? No, you think I didn't like it? I loved it. I loved it. Yeah, of course I loved it. I'm an old soul. I was with my people. I was making people laugh. Patients were crying, telling me how depressed they were as a 15-year-old. And I was able to cheer them up and make them smile. And I got really inspired by that. And I kept wanting to go. And I realized, I was like, I think I really like this population. So I was working with a physical therapist at the time while I was volunteering. And he said, you're really good at working with older people. What do you want to do with your life? And for a career, I said, maybe nursing. And he said, well, you should look into speech pathology because then you'd be able to work with the older people. And I said, okay. So I did that. I also worked as a cashier at Pathmark. I don't have Pathmark out here. Did you have? Yeah, Jersey. Yeah, Jersey, yeah, Jersey. But I was a cashier, and healthcare. I found out it's a lot of customer service. A lot of patients, sometimes families aren't happy, and you have to kind of mitigate things. And so I think as a 16-year-old, making sure that a customer that came in that said, these grapes are 99 cents, and I'm like, well, it rang up 90. It would rang up for $1. Like, you're gonna fight me over 1 cent. I got a lot of experience with customer service, so I knew that I could handle different situations and conflicts, and that I liked older people. So I was like, you know what, I'm gonna do this this career in speech pathology. So next slide. So I chose to go to school in undergraduate. For my undergraduate studies, I went to Kean University in New Jersey. And I learned a lot about neuro, rehab, anatomy, psychology, sociology. I was really into neuro. Any class about older people or working with people, I was really into it. Anybody want to tell me their favorite class in college? Just real quick. Dennis, Q. Anybody? No? Okay, no favorite class? I love neuroscience. That is my topic. And so after a while, huh?
Okay.
Huh?
I caregiver.
Yeah.
Yeah, I do that. I love to be around all people.
Okay, all right, we're gonna be good friends. I got tired of Jersey. I got tired of it, and I was like, I think I want to move someplace else for grad school. I don't want to stay here. Sorry, parents, if you're watching, but I was like, I'm gonna move to DC, and so I went to Howard's campus, and I was like, you know what, I really want to do my master's here. This feels right. So I decided to relocate, and so I got my master's in speech pathology from Howard University. Doing a lot of internships and externships with people that were in hospitals, rehab centers, and I was like, okay, I really like this. So next slide. So how many of you know someone who's had a stroke? Yeah, okay, yeah. They're not alone. Every 40 seconds, someone in the United States has a stroke, which often causes issues with communication, speech, language, and often requiring speech therapy or some type of therapy, physical therapy, OT, maybe it could be like lifelong issues that they have. and approximately 2.8 million Americans sustain a TBI each year. This could be through motor vehicle accidents, falls, and assaults. Those are the top issues. And so I just wanted to share some interesting facts about the people I work with. And then 1 in 9 people with 65 or older have Alzheimer's. And this number, this population, they also have issues with communication and cognition. And by 2050, the number of people aged 65 and older is expected to nearly double. In 2050, I'm going to be happy about that, right? Because I'm going to be with my people. Okay. So, yeah, these are the populations we work with in the field of speech pathology. Next. And so, yeah, so in my field, a lot of people probably think of children when it comes to speech therapy, like maybe somebody with autism or some type of developmental issue. But when it comes to neuro rehab, a lot of people that we're treating have an acquired neurological issue. So something happened after birth. It could be in adulthood or a teen. Something happened to the brain, and now they're having issues with speech, language, cognition, and communication. So the common disorders I typically treat, stroke, aphasia, brain injuries, Alzheimer's, dementia, and Parkinson's. Has anyone ever heard of aphasia before? Yeah, okay, yeah. So aphasia is a loss of language due to a head injury or some type of traumatic event to the brain. And so let's say, so these people really have issues with understanding and expressing themselves. And so let's say I wanted to say, I'm thirsty or I want water. A person with aphasia might say, I want, okay, water. They want to say water, but they can't say it. That is frustrating when you cannot communicate basic wants and needs. I'm hungry, I'm thirsty, I need to use the bathroom, I'm in pain. That significantly affects one's quality of life. It increases burdens on caregivers. And yeah, it could be really devastating to an individual. Also, too, another way to think of aphasia is, let's say we're all English speaking people here. Does anyone speak Mandarin? Oh yeah, actually, I think over there. Yeah. Okay, so we're gonna use a different place. Well, actually, we're gonna stick with China. But let's say you're dropped into China and you need directions to get someplace. So you know what you want to say, but you can't formulate the words in their language. That's kind of like what aphasia is. So you know what you want to say, but you might not be able to understand what people are saying, and they might not be able to understand you. So with speech therapy, we help those issues. Next slide. All right, so yeah, then I began working, and at first I thought my life was gonna be like ER or Grey's Anatomy. I was really excited about that, but it kind of was. It was really rewarding. I started working in the field about 11, 12 years ago. I was much younger and I looked younger. I was working with a lot of people that were 3 times my age, and they were kind of like, honey, did you miss a school bus? Like, who are you? This little thing, tell me what to do. So I had to really establish myself as a healthcare provider that knew what they were talking about, especially with the population I wanted to serve. But I loved helping others. I loved talking to my patients, but it was a Wild West in healthcare with high caseloads, insurance cuts, limited therapy times. Oftentimes we would have therapists work with patients that would come in with a stroke, and literally after a stroke, they would have to go home 2 weeks later. So they would get 2 weeks worth of therapy, and then who knows if they're getting services at home or beyond that. So it was a lot of pressure to really give them the support they needed in that time. And so, yeah, there was limited resources, endless documentation and burnout. But I do feel like the rewards outweigh everything else. But this was just really the reality of healthcare. Next slide. So the problem I couldn't ignore. So when working with patients in my field, a lot of times we give them materials, and these materials, it could be pen and paper. So these are basically tools that help them increase their communication, their language, cognition, their speech. And so a lot of times they're like flashcards or pen and paper and things like that. And so I was like, and this is not really too engaging, but I'll do it. Brain games. When I was in grad school, I had an externship at a rehab center, and my my supervisor told me to do, she told me to give she told me, I had a stroke patient, and she told me to give the patient a puzzle to do as part of rehab. And in my head, I said, well, if this patient can't no longer remember today's date or remember functional things or can't communicate, shouldn't we be working on that based, aside from a brain game? So I wasn't really big on the brain game thing, and I found that a lot of my patients didn't like it either. They were kind of like, well, why am I doing this puzzle, or why do you have me doing this if I'm supposed to be going back home to learn, like live the way I was living before, to function the way I was functioning before. And a lot of the materials actually were very childish. So I had situations where, kind of early in my career and when there was limited resources, giving a 85-year-old vet who had a stroke or head injury something that looks like it's for a child, like, they weren't really too happy about that. It's actually almost offensive to some people. Like, why are you giving me something that looks like it's for a baby? So I saw these issues and I was like, you know what? Maybe I can start creating something on my own for these patients. Next slide. So I started thinking about concepts like how could this product look? Okay, I think I want it to be an app. I want it to be tech. I want it to be engaging, mature. I wanted to look really nice. That was really important to me. I want people to feel like they want to use the app. So I started, like I said, making sketches, and then I was like, okay, it's time to get compliant. I need to get my LLC and think of my business name. I really struggled with my business name. I wanted to choose something, like I was advised to choose like a nonsense word, like a Google or Uber, because I heard that you're able to trademark those things easier. But yeah, I struggled with that. And then one day, 3 a.m. in the morning, I heard everyday practical interventions for cognition and communication. And I was like, oh my God, where's my pen? I'm like, 3 o'clock in the morning. I'm like, I got to write this down. This is a business name. Epic, epic. Everyday practical interventions for cognition and communication. It's an acronym. And I was like, that's the one I'm going to keep. I was a little nervous about um, getting it trademarked, but I said, you know what? If the USPTO grants me the trademark, it's meant to be. And they did. All right. So then I had to build a team, right? Because I didn't know how to code. I'm a clinician. I had to find people to code, people to help me with branding. So I started like reaching out to people in my network. Hey, do you know anyone that codes? And going to events. I'm looking for a coder. I'm looking for someone to help me with my logo. With branding, like I said, that was very important to me. I wanted to make sure people use something that they really loved and really liked, and um, just was aesthetically pleasing. Balancing, I was still working. I love my job working with patients, but it is emotionally draining. So it was hard for me to keep working. And at that time, I was actually working more than 40 hours because I needed to get money to pay for all of this. So I was working a lot, and then I had to come home and work on the app and work on the business. So balancing was hard. I went from traveling a lot internationally and living my life to being at home on weekends with the sketches and trying to figure out everything. And then we started to test the app. The first time I had someone test the app, it was an 87-year-old stroke patient. And I asked her, I said, have you ever used an iPad or iPhone or technology before? And she was like, no. And so I pulled it up and I'm like, okay, you're going to do this task. It's going to help you with your word finding. And she started clicking and she's like getting the answers right. And I see her smiling and she's just so happy using the app. And I was like, wow. Her daughter came in the session, or the daughter came in my office towards the end of the session. And my patient told her, she's like, yeah, I use that. Like I use an iPad. And the patient was like, the daughter was like, oh, mom, you're using like technology now? Oh, that's cool. But the patient was so empowered by that. And that was really encouraging and motivating for her to continue her therapy. So then we were ready to launch. Next slide. All right, and this was my my trademark, my business name, and my kind of slogan, we are the functional and user-friendly speech therapy app. And that's another thing too. Some competitors that we had, their apps were just very complex and it wasn't intuitive. So as part of my development process, I made sure that we really looked at what the patients were having trouble with. So like every screen, every button, we made sure that 80-year-old patient, 90-year-old patient or patients with Alzheimer's, mild to moderate, would be able to navigate it easy. Next slide. All right, then this is my app icon. So we were able to create 80 different cognitive and communication modules targeting expressive language, so speech, receptive, auditory comprehension, word finding, problem solving, memory, orientation, so remembering today's date, and safety. Next slide. 22 is my favorite number. So I said, you know what? This is meant to be. We're going to launch on 2/22/22. This is it. We're going to have all these customers. It's going to be great. I can't wait. Next. So yeah, we were ready to launch, and these are some of the modules that we have. So, try to make things clean, cut. If you see the last one that says functional math, it says Patricia's Creole Cuisine. A lot of apps do not have things like that, so considering people's cultures. So when you go on our app and you do the functional math task, you're gonna see Italian menu, a halal menu, a Jamaican menu. And we'll get a Puerto Rican one soon. A Nigerian one. So that encourages people when they see things from their culture, and then that's a whole nother conversation. Oh, Patricia's Creole. Oh, do you eat beignets? Oh, I love beignets. Oh, you like crawfish? So that type of conversations really help patients with their recovery. So next slide. Oh yeah, and so I'll show you guys a 30-second clip of the app.
Created by speech-language pathologists, the EPIC app is designed to improve speech, language, and cognition in those dealing with neurological conditions. It focuses on real-world scenarios with the aim of delivering more independence around the home and out in the world. The EPIC app is engineered to benefit caregivers, speech pathologists, and individuals living with or recovering from neurological conditions. With more than 80 user-friendly modules, EPIC is paving the path to better brain health.
So that's a clip. So again, more functional. You see the medication management task. You see us asking questions about, what's today's date, helping people with orientation. So yeah, so 2/22/22 came. And do you guys know how many people signed up for the app when we launched? Huh? Ooh. It was more like under 25, honestly. And that was because I didn't know what I was doing. I was so focused on the back end, the app, making sure it was out, making sure it worked, that I didn't really naively, I did not think about sales and marketing. So next slide. So, huh? How much?
Yeah.
So we have a subscription. It's $24.99 a month. So next slide. Oh, sorry. No, sorry. Growing your business as a new entrepreneur. So like I said, I did not know what I was doing. So sales and marketing was something that I struggled with. So a few weeks after I launched, I got a call from somebody in my network, and they said, I want you to do this business accelerator, and it's going to be at universities at Shady Grove, and I really want you to be a part of it. And I was like, okay. So I went, and it was great. It was the first time I got official training in business. I learned things like customer discovery and all this, because prior to that, I had no business background. So that program really changed my life, and I became a pitch finalist They taught me how to pitch. They taught me how to get up and sell. And it was really a big blessing for me. So before that, I did not know these things existed. I thought I had to do everything by myself and was really self-taught up until that point. So yeah, I started looking for more programs, like more accelerators, finding mentors. That was really big for me because up until that point, again, I was self-taught. I didn't really have people in my life that were successful business owners, so I didn't really know what to do. So mentors changed my life too. Then I started attending conferences, events. Maryland has, something, yeah, Maryland has great resources for business owners, local small business centers. There's a lot of free organizations, SBDC, Apex. I started taking their online courses, and they were just teaching me a lot. It was great. Business organizations I got connected with, the NMSDC, they're a minority business national council organization, and then the We Bank organization, which helps with women business enterprises. And those organizations have a lot of different programs. They have pitch competitions. There's ways to get mentors. There's ways to expand your business. And I'm an extrovert, introvert. I'm an extrovert, but I'm pretty low key. So building an online presence was something that was difficult for me, but I've been doing it. I've been on LinkedIn. I'm trying to do better. So that does help with growing my business. Next. And so I put myself out there. I started exhibiting at conferences, our National American Speech Language Hearing Association conference, the National Black one. I started doing pitch competitions. I won some, I lost some. That picture on the right, if anyone's familiar with the rapper Master P, I actually pitched in front of him recently in Atlanta in a competition. So yeah, next slide. Lessons learned. Okay. Does anybody know what an MVP is? Yeah, 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 yeah. And see, I didn't know anything about that before. I thought that I had to build the best product ever and then launch it. So the MVP, in hindsight, that probably would have been the better way to go. It is what it is now. I launched and all that, but I think it is good to, test something out, see if people really want it, and then expand. So instead of maybe having the 80 modules that we had, I could have probably had 5 or 10 and just kind of maybe increase sales and then grow that way. Contractors. It's important to make sure that people say that they can do what they actually can do. I have people tell me, oh yeah, I can do logos. And then I see the logos and it's like, oh my God, like, no, we can't do this. This happened about 3 times with me. And I wasted time and money waiting around for people that I thought could help me, but it was a waste of time. The W-2 cycle is what I call it. So kind of being stuck in this place where, okay, I know I'm still working full time, so I know that money is coming in. So when it comes to my business, sometimes I would feel like, oh, okay, like I don't really have to do this much because I'm still getting money from my W-2. So it's a cycle that I realized I had to get out of. Procrastination was big for me too. When I put so much energy before I launched my business that when I actually launched my business, I was exhausted. I was exhausted. I had no more energy. So every little task, or even if it was a big task, oh my God, it was just like, this is so much energy. I'm done. And then I'm still working. Getting rid of fear. Nike said it the best. Just do it. Just do it. Hiring help. Knowing your numbers, and sales and marketing. Those are 3 other lessons I learned. Can't do everything alone. Next slide. So commitment. Has anybody ever read these 2 books? Yeah, they recently changed my life. The E-Myth talks about there's 3 different people in business. Well, 3 different kind of workers when you have a business: an entrepreneur, a manager, and a technician. So let's say you're a person that has a cookie shop. If you are the person making the cookies and putting it into the oven, your business is not going to grow, because you have to delegate, you have to put energy into growing and not you know, the little ins and outs that you can delegate to somebody. So recently I've hired someone and my business grew significantly because of that delegation. Then the 12-week year is all about shifting your mind from thinking about goals from like an annualized perspective to changing it to like a more like quarterly perspective. So instead of saying, oh, by the end of this year, I'm going to launch my business. It's like, okay, well, think of like a week as being a month and like think of a day as being a week. So that kind of shifted my perspective. Like literally every second counts, every day counts, every minute counts, and to sort of be more intentional with your time and how you spend it. So I was able to do those things. Next slide. And yeah, things started expanding. Finally, finally hired some staff members, started doing a lot of marketing. My app went viral in the last few weeks, and we've had like a significant uptick in sales. I didn't wear my Save TikTok shirt, but I love TikTok now because my app really grew through TikTok, and that really helped my revenue grow. And we've had so many inquiries from people that work at hospitals, people that work at nursing homes and rehabs. And oh, actually, yeah, I actually been nominated to be on the committee of aging for Montgomery County. So that was a big accomplishment recently that I had through doing a lot of commitment and staying focused on my goals. Next. Oh, yeah, this is one of my patients. So these are the settings that my app is currently being used in. And this patient told me Epic is the best speech therapy app. He had a stroke and aphasia, and he told me at the end of working together and with the app, he said, ever since using the app, I'm talking more, I'm speaking more, and I'm flirting more. And I was like, I didn't think about flirting when I made the app, but look, it is what it is. All right, next slide. So from professional to tech innovator. So I feel like I've always been this way. Like if I see a problem, I'm always like, how can I solve it? Or this doesn't make sense, or there's a way to do this more efficient. So if you see a problem at work or even around the house, I say, think like a solver, try to solve it. Do your research, see if there's other competitors around. Um, create your differentiator. And I think this is really easy to do. I feel like at the end of the day, people want something to make their lives easier when it comes to a lot of products. And my app really helped that. My app really helped speech therapists with their prep time. So it really helps with reducing burnout for them too, because they don't have to carry around a bunch of materials and flashcards and search for different tasks to do with their patients. They can just use the app. So the value is there too. Yes, start small, build smart. And yeah, I think about all those infomercials. Remember the infomercials growing up? And like, I was just like, I was always amazed by those. I would just be up late, like, just everything. The Snuggie, the thing that you flip over for pancakes. I'm like, why didn't I come up with that? And then the people that made Snuggie, they were like millionaires. I'm like, this is a backwards robe. So I'm like, there's opportunities out there to make things. Take care. Sorry. Next slide. All right, so what's next for Epic? App expansion. I would like to continue growing my app, strategic partnerships, getting more into research, community education, and advocacy. Recently, as part of Brain Injury Awareness Month, which was last month, I went with a few other colleagues to Capitol Hill to advocate for stroke and brain injury patients, making sure that they continue to have Medicare, Medicaid, that we continue to have research for these patients, funding, and things like that. So we went to we went to our two senators in Maryland. We went to their offices. We spoke with their staff members. We spoke with Raskin's staff members, and that was really important for me to let these staff members hear stories about what's going on with these clients. Next slide. Oh, that's it. Thank you so much. And
Thank you, Camila. From here, we're going to use the microphone, but thank you so much for your story. And what I really, really love about this, the Ignite Hub, of course, is into coding with the Swift, Apple Swift and everything. But we often talk with middle school students and, K-12 students about why coding is important. And we always talk about solving a real life problem. And that is exactly what you did. You told us the story of how you saw a problem and you wanted to make it better. And also, of course, we want to build coders, but you don't know how to code, but you know how to find the resource to bring to life what you wanted to do, which is also important when we're talking about people who are interested in tech or getting into coding. You might have this really amazing idea. It's okay. You don't always have to learn the coding, but can you find the resource to help you do that? So I really appreciate that you illuminated that for us. So thank you again. This is where we open up the floor to our guests here in person or online. Please put your questions in the chat, or if you're here, raise your hand and we'll pass the microphone. Thank you. Are there any questions in the chat? Anybody here have any questions? Great.
Could you elaborate a little bit more on the roles you described in the EMIF? I saw it on one of the slides. I'm curious about that. I think they were technician, manager, entrepreneur on the book of the EMIF.
Oh, okay. You'll have to read the book. Yeah, but I think here it says technician operates with a system to create the results that moves the vision forward. So they're doing all of the tedious tasks. Yeah, like coding. Yep, yep, yep. Manager translates vision into systems and delegates the task to the technician. And then entrepreneur, they're just really growing the business. Mhm. Yes, you'll have to.
Jen, I got you.
Just a question. Thank you for coming and sharing your story. The LLC process and the programs that helped you, I guess the Shady Grove group, and what process or challenges, lesson learned from that you would redo or do differently?
Thank you.
Yeah, the LLC process was pretty easy. I went to InkFile. I think they have LegalZoom InkFile. So all I did was really just contact those websites and told them I wanted to create an LLC, and they really just did everything for me. In terms of the accelerators, I follow a lot of business pages on LinkedIn, and sometimes I'll see colleagues of mine, they'll say, oh, like I just wrapped up so and so business accelerator. And I'm like, what? Okay, I'm writing that down. So that a lot of times that's how I find out about events. Events, accelerators through my network, LinkedIn, doing Google, and then connecting with local business organizations. Their email list usually has a lot of good things for accelerators or good resources or recommendations. Mhm.
So are you working full time now on this app, Epic, or do you also still have your day job, or are you balancing them half and half?
Yeah, I actually recently cut down. Up until now, up until recently, I was doing home health. So if you're familiar with home health, it includes you doing services at home for homebound patients. So a lot of my patients wouldn't be able to walk or go out for outpatient. So I was doing home health in DC. So what happened recently with traffic patterns? Okay. So I had to kind of cut that down because that was becoming a lot. So I have cut down on my home health hours, and because of this new commitment that I'm having and the growth, I am starting to work more on my business. Yeah. But I can't forget about my people. It's like I'm serious. I really, even if I were to become a billionaire, millionaire, I would still work with my patients. I a few years ago, I worked in a school. I did a small contract with, I think it was high schoolers and middle schoolers in the school district. And my friends called me and they were like, "How's everything?" And I'm like, "I'm not doing too well." Like I literally got depressed. I'm serious. And I was like, I miss the old, sorry if it's say old people. I was like, I miss the old people. So it's, even if I work, it's still important. Even if I'm working on the business, it's still important for me to work with that population. And two, you get to see in real life how it's impacting them. So it's like ongoing research with them.
What advice would you give to your younger self?
Okay, now y'all getting too deep. Relating to business, relating to anything, anything. Oh, um, hmm. I'm a deep thinker, so this is really resonating hard with me. I'm like, what do I say? Younger self. I don't know. I think I would just do everything the same. Like, just, I'm grateful for all the mistakes I made because it made me stronger. I don't really I don't really have advice. I would just say just have fun. Life goes by fast. That's it.
All right, we have a couple of questions in the chat. Samuel says, "Thank you so much for your presentation. What was the most challenging part while working and building the platform?"
Sales and marketing. Oh no, while building, right?
Mm-hmm.
Oh, wow. Okay. So finding a developer and doing that quality assurance. So because funding was limited, I had to make do with what I had. And um, I had to do a lot of testing on my own. I had to make sure my developer actually had a full-time job too. So that was a barrier with getting things out fast because I didn't really have the funds to get it done in 2 weeks. So it was a long, drawn out process. And so, actually, too, I would say, I think actually I have, I'm thinking about his question now. I would actually look for funding because I feel like a few years ago, the grants, there were a lot of grants were being given out for businesses, and now a lot of that has dried up. And I kind of missed out on some of those opportunities. And as a person that was mainly self-funding their business, I feel like that could have took me further. So.
And the next question we have from Rosalie, "Great presentation. How did you create business partnerships and or found people that could work for you?"
Um, I would say going on freelancer websites, or talking to people that are in your area. I like Montgomery WorkSource, right? They have a great program where they pay a portion through the county. They can pay your pay workers. So I've heard of things like that, where certain programs help you with paying people. But I think for me, just again, tapping into my network, asking who knows who, and tapping into like freelancer websites has helped me. So Upwork, Fiverr. I can't speak for Fiverr. I've heard about it, but I've used Upwork. Mhm.
I do have a question. So following up with the testing, with the limited resources that you had, how did you conduct that beta testing? Because that needed to be done with people that actually were in the condition that you were trying to help them with, right?
So yeah, we had to, my patients, I had them use the app. And then also the app was shared with other clinicians and therapists that gave us their feedback. And so we adjusted the app based on their feedback and their recommendations. So pretty much sharing the app with other therapists who had a caseload. Yeah.
Couple more questions here. Sir?
Hi, thank you for the presentation. You mentioned something that's very real, which is the entrepreneur's burnout. Um, and if you look at the timing of your burnout, it happened right when we were still in COVID, right? So, what's like, how did you get over that burnout? Like, what sort of things did you do, or what helped you get over that burnout to keep going? Because a lot of entrepreneurs, they actually end at that burnout, but if they do get there.
I think staying spiritual and knowing that I do believe that this is my destiny. Sometimes I think back to some patients that I've worked with who have given me a lot of words of wisdom. Like when somebody in their 80s tells you you're going to do something really big. I don't know what it is, but you're going to do something, like people tell you things, or you're just really spiritual and to me, that kind of kept me grounded. And also, too, just knowing that this problem is going to get bigger. So, like I said, 2050, the population is going to double. Something has to be done. And plus, I was still using the outdated resources that I didn't like. So I'm like, I have to make something that is better because I don't like what else is out there. Yeah, you just have to, like Nike said it, look, just do it. I just had to do it. Like,
Question?
Thank you. The story really touched. I have a question about since you launched the app, how you make it. I mean, when they are viral and then the people bought it, right? But what you do now, keep improving or to make the marketing running?
Thank you.
yeah, so I'm learning that marketing never ends. It's a song that never ends. I have to just continue doing it. So I made a commitment to keep marketing TikTok, Instagram, ads ongoing. In terms of, were you talking about making the app better? Yeah. Improvement. Yeah. Mm-hmm. 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 Yeah. So I have a lot of plans for Epic. So I already have in my head what I would do for Epic 2.0. And then we do take what customers say to us. So sometimes people give us feedback. Oh, like, does this have this? Or I have a patient with this. Can you guys do this? So we're taking account all of that, and hope to maybe launch some new things in the future, new tasks in the future.
So thank you again for bringing light to a problem that I believe that a lot of people don't really realize how big it is. For example, when you ask who here knows what aphasia is, I didn't know until I actually read it in the news that Bruce Willis, a famous person, got aphasia. So how big really is this problem? You kind of touched it a little bit, but looks like that it's bigger than what I knew or I thought.
Yeah, it's growing, and this is something that affects people of all different groups, ethnicities. I've had patients in this area that were very high profile patients. Um, so everyone can be affected by this. And with the aging population growing, yes, Alzheimer's, strokes, these things are going up. Now there's more technology to save someone after a stroke. But when you save someone after a stroke, there might be some impairments that they have. So that's why guys got to eat healthy. Got to take care of yourself, exercise, and try to reduce the chance of getting one of these issues in the first place.
I have a question to piggyback on his question, which I was thinking about. How do you measure success? Like, what would have to happen for you to sit back and go, this has been like a successful app? Like, in like say 10, 15 years from now?
I can't share my private dreams with you. I would say I want Epic to be the go-to app. If someone has a stroke and they're in a hospital, I want people to think of, okay, we got to get Epic. Where's the Epic app for this person? So I want to be widely recognized. We already have customers and patients. Because of the software, we have patients using the app in other countries, Canada, New Zealand, Australia, the UK. So here, we want to be the go-to one, and even internationally, want to be recognized for what we have.
Thank you so much.
Okay, well, if we've addressed all of our questions here right now in the presentation, thank you for our guests online and our guests that are here. And I know that Camila will be available afterwards to talk to you individually. But again, I'd really like to thank you for your time to come out. All of our speakers are volunteers that come and share their experiences with the community. Camila is also an alumni of the Montgomery County Black Collective. So they've been a wonderful partner with us, not just in using, collaborating and using our space, but honestly, being able to find high quality speakers such as yourself to be able to tell your story. You don't know how your story will impact somebody here, somebody online, or somebody in the future on our YouTube channel who watches. Your story makes a difference. So I just wanted to thank you for your time to come out. I do have a token of appreciation with some Hub swag for you. So thank you for coming to the Ignite Hub. Thank you to our guests. You all have a choice of where to be tonight, and you chose to be here. So thank you for that. Camila's information is on this slide. You can also connect with her later. Very shortly, as I'm speaking, Anthony's going to bring up the QR code and put it in the chat. Please fill this out. We do share this information with our guest speakers so that they get information about how their presentation went and information for the Ignite Hub, so we know what other speakers, what other topics would you like to see here at the Hub. We do sit down and go line by line and look at all of our feedback because we want to be responsive to our community. While you're filling that out, I'd like to do a little bit of promotion of our other upcoming activities. We're busy this week. Tomorrow there is a monthly career workshop that's hybrid. The topic is career exploration. We also have our next Future of Tech Lunch and Learn, which is 2 weeks from now. We have Megan Cooperman, who's our wellness specialist, and she's going to be talking about wellness for tech professionals. We want to make sure that we are taking care of ourselves as well. Eduardo is also doing a presentation. We have our IT Career Pathway session number 2, where he's going to be talking about, let me scroll this up a little bit. He's going to be talking about support networking and cybersecurity in careers. So if you or somebody in your network, we know that many people have been impacted by the federal layoffs and are looking for new opportunities. So please encourage them to do that. And at the end of the month, we have our second boot camp, which is on app design, which I've heard is sold out. So I'm glad that we were able to provide something that the community is looking for. And lastly, also, it's closed now, but the Brand Accelerator, which we had entrepreneurs come and learn about digital marketing for their business. It's going very well, and we plan to offer it again in the fall. So keep your eyes out for that. Thank you, everyone, for coming tonight. Thank you for your feedback. There is still food over in 103, and if I'm not mistaken, they're probably already prepackaged, so it's take it and go. You don't have to make your own, just grab your to-go container. So with that, thank you, be well, and we'll see you at the next event.